Hey, this is Sandy,
And Randy.
and we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. This week we have an education episode, and this education episode was inspired by you, Sandra.
Wait, what?
Yes. She brought up a good point maybe a week or two ago, how it would be nice to do an education episode on like modalities or like some kind of review for the clinicians out there who it's been a while since
For me.
But it brought up a good point is we learn a lot of cool things about modalities in our modalities courses, and we tend to forget them because we really don't get a chance to utilize their full spectrum. So you kind of lose like, oh yeah, you're right, I can do that with this modality. So
Honestly, real talk. I feel like most of the time if we set someone up on STEM, it's going to be a pre-mod or IFC.
yeah, and you can actually get really creative on your settings and your parameters and everything you want to do. And again, it's something that we were taught. It's just sometimes you don't have the time to sit there and play with the machine and like get parameters correct. And sometimes you just forget because you haven't done it in a while.
Also, if your first job's at a high school, usually they don't have modalities.
You don't have modalities, so then you don't even get to practice what you already learned.
Yeah.
So for this week, I'm starting off with electrical stimulation, but not just any type of stim, or like my one athlete liked to say, stem cells. But we are going with neuromuscular electrical stimulation. So the idea here is we're doing muscle reeducation, muscle strengthening, using stim for that aspect. The objective of this episode is we're going to review the important part and principles in regards to electrical stimulation. So just get a background of the terms that are commonly used in the literature. We're going to understand the physiology of electrically induced muscle contractions because they are different than your regular muscle contractions. And then we'll look at the evidence on how effective is using NMES.
All right, Randy, how many articles would you say you had to review to put together this topic?
About 16, 17.
Okay, that's a good number.
But also, I have some good background. This episode might be for you, Dr. Sang, because in my modalities course, we had a project where we had to read about a certain modality, and we had to read like 10 articles or so, and we had to basically sum them up.
That's a lot of articles.
It was for the whole semester at least, so
okay.
It was fair. And I did mine on NMES. So
Bringing it back.
Bringing it back. This one's for you, Dr. Sang.
So let's get started with the principles of electrical stimulation.
Yeah, so just a couple of key terms. So anytime you read, you're always going to hear different terms thrown around. One of them is going to be phase duration. So this is kind of interchangeable based on what you read, but you can also hear it termed as pulse width. And essentially, this is the length of time that the current is flowing in one direction. So it can get a little technical if it's a monophasic or biphasic, which means it has a positive. Monophasic would be it just has one charge, either positive or negative. And then a biphasic has positive and negative. It's like a sine, like a sine curve.
Like a roller coaster, up and down.
Exactly. So essentially what that is, what this pulse width or phase duration is, that length of time the current flows in that one direction and then comes back to its neutral. This is the idea why this is so important is it determines what nerves are being depolarized. So your A betas, your A alphas, C fibers, and all those, or A deltas as well, they all have a different kind of timing or a phase duration that's perfect for them to depolarize. So this is where it'll kind of get important why you have to be picky on your phase duration. The next term is frequency. So this is the number of pulses per second. So how many beats are you going to feel from this stem? So if you set someone up on a frequency of 2 hertz, they're going to feel 2 beats in 1 second. Whereas if you put someone on 150, they probably won't even tell the difference. Like they're just going to feel a constant tingle because it's 150 beats that are going in 1 second.
So frequency is the amount of times that the patient is feeling
the current.
Exactly.
Yes. For NMES, this will help determine the amount of muscle tension you're trying to produce. It essentially, the higher the frequency is going, the faster the nerves are firing because that's how many pulses in a second it's getting. And then the last one is one that we all know, but we never call it this, is the amplitude. Essentially, this is the intensity of the treatment. This is the number that you keep pushing up. and that athletes always try to beat for some reason. I don't understand why they think more is better.
Oh, because they have to beat their friends.
Oh, yeah. All the time they're like, oh, man, I'm only at 20. I need to be at 50. No, you don't want to be at 50. So this will be important when we're trying to determine what kind of stimulus we're trying to get from NMES and why it's so important and why we get the adaptations that we get from NMES.
Okay, so let's go back. The phase duration is the roller coaster, so the length of time that the current's flowing up, the length of time that it's going down, any time that it's going in one direction. And then the frequency is the number of pulses per second, the one that the patient's actually going to feel.
Yes.
And then the amplitude is the intensity. So how intense, or just if you amplify the treatment, that's what the amplitude would be.
Yeah, there you go. I like the usage there.
Okay, so let's move on.
So the whole point of us doing this kind of treatment, neuromuscular electrical stimulation, is we want to get muscle contraction, right? But there's actually a difference between you contracting your own muscles and how the electrical current contracts your muscles. So if we can all go back to school and remember the size principle, right? Our muscles contract based on what's called the size principle. And essentially what this means is that the order of recruitment is determined based on the load. So when you first start lifting something or start contracting your muscle or lifting something super light like the tape on our table, your body's probably just going to activate your smaller, slow twitch fibers. Your body's like, this isn't a challenge. I'm going to activate as little powerful muscles or fibers as I need to get this done.
To be more efficient.
Exactly. But then the minute you add the tape with, 100 pounds on it, your body's like, whoa, hold on. I need to do more. So then it starts to switch to your larger, fast twitch fibers. That's what the size principle is. It basically determines how it's going to shuttle through muscle fibers being recruited based on their size. And the larger, the more load that's needed, or the more load that needs to be overcome. In electrical stimulation, it used to be thought that it was reversed, that the electrical stimulation activates the fast twitch first and then the slow twitch last. Some literature on that's a little bit iffy. It's kind of now what we've noticed is NMES just doesn't care what muscle fiber is being activated. It activates them all. So NMES has no size principle. It just says small, slow twitch, large, fast twitch. We're going all together on this one.
If you're a fiber, you're being activated.
That's right. If I'm throwing a current at you, you're being activated. So essentially what's happening is there's no selectivity in this current to what muscle fibers are being activated because all of them are. So the slow twitch and fast twitch fibers are being activated at the same time. You can see that's kind of weird because your body's used to doing it in an organized fashion based on the load. Whereas NMES, it doesn't matter what the load is. They're all working at the same time. So we'll talk a little bit why that's kind of a big deal as we get going, as we talk about motor unit recruitment. So another way that your body likes to contract its muscles is it tries to activate different motor units to keep tension going and to reduce fatigue. So say motor unit 1 is firing, but then it's not going to fire the entire time during the contraction. The body's going to switch to motor unit 3 and give motor unit 1 a break. And then it's going to come back to motor unit 1 and let motor unit 3 relax. So it's going to try and alternate to maintain your contraction, but also reduce the chance of fatigue. Again, NMES doesn't care. NMES just comes in and it's going to stimulate that same motor unit throughout the entire session. So if you're lifting something, motor unit 1 is on the entire time. Whereas in a naturally occurring, it would go motor unit 1, motor unit 3, motor unit 1. It would alternate like that. So you're seeing this asynchronous activation, and this can also increase the rate of fatigue. So you've lost the size principle that tries to protect the muscle fibers, and now all of them are being activated. And if we remember those type 2 fibers, they fatigue a lot easier than type 1, which are fatigue resistant. So there's a way fatigue can be increased. And then also you're activating the same motor unit the entire time. This is also going to increase the rate of fatigue.
Yeah, so basically what you're telling me is NMES is like that coach that doesn't give anyone breaks.
No, it doesn't even care. No shot, doesn't care. Now, we already talked about how the amplitude and stuff creates the muscle tension, and that tension's giving you signals, right? And then same thing, the motor recruitment, you're trying to maintain muscle tension to create your torque. All those signals, all that tension the muscle's producing, signals adaptation in the muscle. So, I mean, that's the whole point of working out. When you lift something, or when you go weightlifting or go running or anything like that, right? The muscles produce tension. That tension signals the cells within the muscle that, hey, the thing that we're doing is really hard. We need to adapt so this becomes easier and more efficient. Keep that in mind as we roll into, does NMES work for what we think it does?
Tell me, does it?
So a lot of times people like to use NMES. The first thing you think of is strength. Can we use NMES to increase our strength? The evidence behind that is yes, you can. There's some caveat to that though. So there's some idea of what's called a ceiling effect. Essentially, if you have so much strength already and you apply NMES, are you really going to get much more of a gain? Probably not. And it's the same thing. Like if you have so much strength when you're lifting naturally, at some point you're going to hit a ceiling. And like I can't really increase my strength as greatly as I could normally. It's going to take a little bit. You got to change something up and all that. So it's the same thing with STEM. If you have a bodybuilder and you hook up STEM to them and you're trying to do NMES and increase their strength and you set the parameters perfectly and that's all you do, you're not going to see probably a lot of strength gains because they've already have such a huge amount of strength gained already. So if you have someone probably like me who's, I'm not a bodybuilder, let's just say that. Right? Would you agree?
Definitely agree.
Okay. You didn't have to agree, but that's fine. Right? I might actually get some pretty good strength gains off of NMES compared to Sandra here, who's jacked.
Wow, glad you think so.
So there's another thing that comes up with NMES is, how does it compare with voluntary contractions? Like, okay, we can increase strength with NMES, but is it better than just doing exercise yourself? The literature's not very supportive of that. You know, there's some literature that says it might be a little bit better, and then there's going to be some that says it's really not that much better, and voluntary contractions way better to go. Like I said, I'd say you can see small gains with NMES, but your voluntary contractions, you're going to see a lot more improvement, and it's just going to be better for you in the long run anyways. So unless you have someone that's post-op or has certain conditions where they can't actually do an exercise program, like a lot of times you hear cardiovascular, or some of these studies are done on COPD patients, which was very interesting. And NMES would be perfect for them because they can't do such a high intensity exercise program. They can do this and still get strength gains from it. So to answer the question, does NMES increase strength? Yes, it does. It's just, if you have someone who's already really strong, it may not be as beneficial as something else. So along with strength, and probably one of the most important things to any bro that's out there, is hypertrophy. We are all about the gains on AT Corner.
That you can see.
The gains that you can see. And evidence for NMES inducing hypertrophy, it's pretty good. Also, it can also prevent atrophy. That's kind of weird to think about. Like, okay, well, that's hypertrophy. Not necessarily. You still might atrophy a little bit, but not as much with STEMs.
I can actually get preventing atrophy, but I'm kind of surprised by the whole inducing hypertrophy aspect.
Yes. I mean, again, same thing as the strength. You're probably not going to get like jacked with NMES, but you definitely can start seeing an increased size in the musculature. There's some literature that has shown that NMES can actually induce the anabolic signaling process. So essentially what that means is that's the signaling that tells your body that, hey, we need to adapt. We need to build more muscle tissue. It can actually increase the signaling there. What I also thought was interesting, and I didn't get to read the articles, I only kind of skimmed it, but it's starting to become a thing of combining NMES with blood flow restriction.
Ooh.
And that it's actually, you get better outcomes with the both of them combined than them individually.
If you guys have done this, please head over to our Facebook group and let us know.
Yes, apparently the signaling for like mTOR and all that stuff that's supposed to signal, you know, your gains, your strength gains and muscle tissue, it was actually a lot higher when those were combined. So I really thought that was interesting.
Yeah, because BFR is a hot topic right now.
Oh, big time. Now, like we said, this signaling is dependent on the exercise intensity. It's the same thing when you go lifting. If I'm just lifting 3 pounds all day, my muscles probably are not, well, for me, they might signal a lot, but in general, they're not going to signal a lot, right? But if you lift, you know, your 1 rep max, you go max out all the time, your body's going to signal like, hey, this is pretty intense. I need to do something. It's the same thing with NMES. Intensity is going to play a role into the degree of change that there is. Higher intensity NMES is actually going to give you greater gains. Your low frequencies, and we'll talk about the parameters towards the end, but if you're going like 20 hertz on your frequency, you're still going to see some gains, but it's not going to be as much as someone who did 50 or maybe 75.
What's your max? Max hertz?
A lot of times the literature sits around 50. Most of the time you're probably not going over 100. Because a lot of that goes to patient comfort as well. As you get higher than 50, it starts to become a lot more uncomfortable. So I would say sticking around 50 will be good. If you're getting around 100, that's pretty aggressive.
Only for your toughest of patients.
Oh, yeah. Or the ones who think they're super tough. Another idea that you could use, and we talked about the re-education part, is activation. Using NMES to activate a muscle that isn't active like it should be. And I do believe that there is some credit to this idea because we already talked about the strength part has a ceiling effect, right? Well, if you already have someone who doesn't have a lot of strength in one area or they can't activate that muscle very well, they have so much room to grow. And it's hard if someone can't already activate the muscle to have them voluntarily activate that muscle when they already kind of don't know how to do that. So this can help kind of give you that role and like, hey, let's get that little push going. So there is literature that shows that NMES can increase spinal excitability when you pair it with a voluntary contraction. So you turn on the machine and you have them contract with it. Essentially what that means is that's the pathway, that's the reflex for the muscle. So that whole spinal excitability comment is talking about the reflex in the muscle. So like that stretch shortening cycle. So that could be an idea to, hey, maybe it improves the power of the muscle. It's increasing that pathway of that sensory feedback that the muscle already has. So maybe that stretch shortening cycle can get better. And that's how another way you can increase their activation that way. So that also brings up the question of, well, a lot of times we're not just going to hook them up to stim and that's our exercise for the day, right? We're going to do something else. So why don't we combine it? You know, if it's good on its own, what about comparing a voluntary contraction with the electrical contraction? And there actually is some pretty good evidence for this. You see a lot greater improvements than each one individually. I think one of my favorite ones that I read was they took ACL reconstruction patients, and within around 2 weeks, or when it was safe for them to actually start to do like a sit to stand to sit task, so essentially like a mini squat kind of deal, they had one group that they hooked up with the NMES, and then they had another group that just did it, and then they had a group that did normal rehab. And the group that had the NMES with the squatting task actually had a lot better improvement than everyone else.
Oh, that's really interesting.
And what I think is very important is when we talk about ACL reconstruction, that the ACL injured leg, the quads always tend to be atrophied, right? That's a chronic issue. We all have seen it. The quads also don't fire quite like they used to. That's a problem that leads to long-term poor outcomes.
Yeah, it's a protective mechanism that leads to bad things.
Exactly. And then also, you know, they don't like to load that limb a lot either. They try to protect it by not loading it, which, again, that's not a good movement pattern long-term. But when they did the NMES with the squatting task in early rehab, mind you, they kind of stopped it after they moved to their next phase. Just the small time frame that they actually did the NMES and the squatting task, they found better loading on that leg. They found more strength in the quadriceps and hypertrophy.
Hey guys, pause this right now, write that down, and use it in your next ACL patient. If you don't get anything else out of this, that is our action item of the day.
So it showed that...
That's really fascinating.
Yeah, so it showed that I thought it was really cool because it paired the electrical stimulation with contraction types, so concentric and eccentric. So it wasn't just isometric, which is what we commonly see early ACL is you do quad sets. You put them on the NMES and you have them isometrically contract with it, which is good and it's very important. But this also now paired the NMES with a functional task. So don't feel afraid to try that. Of course, you're going to have to adjust the intensity because you want it to be comfortable enough for the patient to actually do a contraction instead of the NMES just overtaking them and now they're scared to move. You still want them to be able to contract with it and actually go through a concentric and eccentric phase. But like I said, they didn't do that for the entire rehab. They only did it in one phase, and it lasted up to like 6 months follow-up, and they still saw better loading, better quad activation, and strength.
I love that.
That's wild. And again, no shout-outs to any certain companies, but they used a Compex-like device. So that just shows you there are functional abilities to those devices, and the parameters for them were within the recommended, which we'll go over. So one of the problems that people like to bring up with NMES is, like we said before, right? It only activates that one motor unit. That's not how the body works. Your body likes to switch through motor units. They have actually created a NMES device that's called pattern neuromuscular electrical stimulation. And that is supposed to change where the signal's coming from to activate different motor units. So it's making a more natural activation pattern. I didn't get a chance to dive too much into this research, but a lot of them have been looking at it for patellofemoral pain patients and also increasing vertical jump and all that. And they're finding really good results because the muscles that they're putting it over are activating in a way that the body normally would. So stay tuned on some of this new literature that's coming out in these new devices. It's not just the same old, we'll hook them up to Rush and we'll call it a day. No, there's going to be a lot more stuff coming out that's going to make it even more functional to use and can really give you some great outcomes.
That's exciting. So NMES is adapting just like your muscles adapt?
Exactly.
Uh-huh.
That was good.
Okay, so last thing, parameters, because I like tangible, actionable things. I know we're going to put some of these, I planned on doing some cheat sheets on our Instagram.
Yeah,
you want to
good
just
to me.
go over the parameters right now?
Yeah, so that's the funny thing, like when you hear like a modalities talk and stuff like that or like you hear NMES like, oh, you can increase strength, you can hypertrophy, you can do all these things with NMES, and then after the talk, they don't tell you anything about how you're supposed to do that. So what's in the literature, the optimal parameters that have been talked about are the frequency should be around 30 to 50 hertz. You can play around with that, of course. There's some studies that went up to 75 hertz, and I believe the Compex units or something that's similar to that, their pre-programmed setting is around 75 hertz. So don't feel like you have to stick at 50. You can go a little bit more. Just know you might have to adjust because of patient comfort, but 30 to 50 is going to be what's optimal. The pulse width or phase duration should be around 200 to 400 microseconds. So in that window, you're getting a good chance that you're activating the alpha motor neuron. So that's when we're trying to do NMES, that's what we're trying to activate. And that pulse width should be in that window to activate preferentially that nerve instead of your A deltas, your C fibers. Of course, the closer you get to 400 microseconds, you're probably going to activate those as well. So keep it around that window of 200 and 400 microseconds. Again, there's some studies that they went up to 1 millisecond. That's insane to me because I believe muscle tissue, the tissue itself, depolarizes around 1 millisecond. So it's kind of aggressive, and most of our stim machines in the clinic actually stop at 400. So you're really probably not going to go more than 400. And then the duty cycle. This is essentially the on-off cycle. Again, NMES is a very fatiguing thing. And you can definitely get sore, especially on a high-frequency NMES. If you go 50 and above, you can get sore from it because it can be an intense contraction. And also the fatigue aspect of it as well. So the literature always talks about, and I'm sure we talked about it in class as well, is a 1-to-5 ratio. So it's on for 1 second, off for 5 seconds. A lot of times on the machine, it's on for 10 seconds, rest for 50 seconds. That's usually how it goes. And you'll want to stay there. If you go out of that range, just know you're going to do something else to minimize the fatigue.
Yeah, and I know later in rehab you can change it to like a 10-30 instead of a 10-50.
Exactly. And I think it goes back to Dr. saying this one's for you. What's your goal? Have an idea of what your goal is, and if you are trying to train a little more endurance, you may want them in a more fatigued state than a 10-5 or a 1-to-5, right? Maybe 1-to-3 is going to be ideal for what you're trying to do. So That's the nice thing, and that's why athletic trainers get paid the big bucks, is we get to make these critical decisions and these, clinical decisions and going on from there, right? Use your imagination. Just think through the situation and achieve what you want to achieve.
Yeah, and you can do this as much as twice a day. You want to separate it by 3 to 4 hours because, again, like Randy said, it is a fatiguing process.
Yeah, and if you go high intensity, high frequency, they're probably going to be sore, so don't be surprised if they come in and be like, yeah, I'm a little sore.
Yeah, so all of the citations that Randy used on this episode will be on our website, which is, if you just scroll down to our show notes below, then you can go ahead and click on that. And then we want to know what type of stim that you guys use the most. And you can answer that question in our Facebook group, which is an interactive group. There's only one question to get in. It's, where did you hear about our podcast? And to find the group, just search AT Corner Community on Facebook, or again, the link is in the show notes. If you guys are new, we do every other episode as education or stories. This one was an education episode. So next week, we're going back to our story sharing experiences from other athletic trainers. And then we're going to continue on with this education series. And we have a couple interviews coming up. So
yes, we do. We're really excited for them.
Yeah, you got anything else to add, Randy?
Nope, that was perfect. Thank you for helping us showcase athletic training behind the tape. Bye.